Question 51. Mrs. Shumway has an order for I&O. You have picked her breakfast and notes she drank half of a 6-ounce glass of juice, 4 ounces of milk and 8 ounces of coffee. You document A. 240 cc, B. 920 cc, C. 450 cc, D. 685 cc. Answer C. Explanation. The question is about half of a 6-ounce glass. 15 ounces equal 450 cc. When converting ounces to cubic centimeters cc, remember that 1 ounce equals 30 cc. Although an ounce is slightly more, the amounts are considered to be equal by doctors and pharmacists. Also, 1 cc equals 1 millimeters. Question 52. Which of the following is not true of blindness? A. Most legally blind or visually impaired people have no sight at all. B. Diabetes is an important cause of blindness. C. Always identify yourself before touching a blind person. D. Ask if a blind person needs help before giving assistance. Answer A. Explanation. Most legally blind or visually impaired people have no sight at all. Explanation. People who are legally blind or have visual impairment may still be able to see, but images can be quite blurry even when wearing glasses. They have difficulty reading and are restricted from such activities as driving. Another disability is related to having tunnel vision, which means the person can only see straight ahead instead of the normal ability to use peripheral vision to see almost 180 degrees. Only about 10 to 15% of people who are diagnosed as blind see nothing at all. Question 53. A patient has a diagnosis of psoriasis. Her nurse aide should A. Treat her the same as any other patient with a non-infectious disease. B. Wear a mask when entering the room. C. Wear gloves for patient care. D. Avoid contact with a highly contagious lesions. Answer A. Explanation. Autoimmune diseases are never contagious. They happen when the body's defense system attacks its own healthy tissue by mistake. Besides psoriasis, other examples of an autoimmune disease are lupus, celiac disease, multiple sclerosis, and type 1 diabetes. Client care is the same as for any other client without an autoimmune disease. Question 54. In reports, the nurse aide is told that one of her patients has been ordered NPO after midnight. The aide should A. Offer frequent snacks. B. Ask the patient if he is having any pain. C. Take away the water pitcher at midnight. D. Note all water the patient drinks and all output. Answer C. Explanation. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor orders a patient to be NPO at midnight for situations such as before surgery or certain lab work. The nurse aide can provide mouth care for a client who's NPO. Placing an NPO sign over the client's bed and on the client's door will remind all staff members not to give the client anything to eat or drink. Question 55. Before performing any procedure, a nurse aide must A. Wash their hands, B. Identify the patient, C. Explain the procedure, D. All of the above. Answer D. Explanation. Clinical standards state that all healthcare professionals must identify the client by checking the ID band or tag before providing care. They should wash their hands before and after an encounter with the client. They should also explain what they are going to do and give the client an opportunity to ask questions before proceeding. Question 56. The brain is part of the A. Exocrine system. B. Nervous system. C. Endocrine system. D. Locomotor system. Answer B. Explanation. The nervous system has two parts. The brain and spinal cord make the central nervous system. CNS. The peripheral nervous system (PNS) is made up of all the body's nerves which connect to the CNS. The brain sends messages through the spinal cord and nerves to control the body's muscle and organs. It also processes and interprets the information from both inside and outside the body. Question 57. When taking a rectal temperature, the nurse aide should insert the thermometer and A. Stay in the room until it is time to read the temperature. B. Hold onto the thermometer until it can be removed. C. Take care of the other patients and return in 3 minutes. D. Go on his break. Answer B. Explanation. A rectal temperature is the most accurate but needs to be done correctly. After placing the client in Sims position, lubricate the thermometer and gently insert it about 1 or 2 inches into the rectum. Hold the thermometer in place for 2 minutes to prevent it being pushed out or advancing into the rectum. After withdrawing it, wipe it with a Gaunt's pad, read the temperature, and place the thermometer in the used container. Question 58. You're caring for Mr. Brown, who has a diagnosis of COPD. His SpO2 is 82%. He's currently receiving O2 via nasal cannula at 2 liters per minute. What do you do? A. Ask Mr. Brown to take breaths more frequently. B. Switch the nasal cannula to a mask. C. Report it to SDAT to a nurse. D. Turn up the O2 to 4 liters per minute. Answer C. Explanation. The normal SpO2 range for clients with chronic obstructive pulmonary disease (COPD) is 88 to 92%. This is because oxygen reaches the lungs, but lung damage prevents oxygen from getting into the blood. Giving oxygen is carefully regulated for clients with COPD, with limits according to how the oxygen is delivered. Immediately report a low saturation to the nurse. Do not make any changes on your own. Question 59. What is the best way of keeping a skilled nursing facility from having an unpleasant odor? A. Empty pad bands and change linens in a timely manner. B. Keep all the windows open. C. There is nothing you can do. D. Use an air freshener regularly. Answer A. Explanation. All staff in a skilled nursing facility are responsible for maintaining a pleasant environment. Any source of odor must be dealt with at once. Bedpans and commodes should be emptied and cleaned as soon as the client finishes. All linens should be changed per the facility's policies and as needed. Soiled linens should be transferred to the laundry facilities as soon as possible. Housekeeping can clean the common areas, dining room, and client rooms to prevent odors from food or incontinent episodes. Question 60. Meal trays have arrived. Before serving each tray, the nurse aide should A. Ask about dietary restrictions. B. Ask patients if they're hungry. C. Check the temperature of the food. D. Check each armband, even on familiar patients. Answer D. Explanation. Before serving a meal tray, always check the client's ID band to tag and match it with the correct tray. Some clients have special diets, severe food allergies, or strict food restrictions. While it can be tempting to skip this step in a long-term care facility, the nurse aide is legally responsible for verifying the identity of each client before serving food or giving care. Thank you for watching.